This line graph tracks CDC data from 2003 to 2006, detailing a threefold increase in childhood obesity across all age brackets. Prevalence reached 12.4% among children aged 2 to 5, 17% for ages 6 to 11, and 17.6% for adolescents. Clinical data establishes that obesity reliably tracks from childhood straight into adulthood, exposing millions to a lifetime of compounding health risks. This reality has prompted a wave of aggressive legislative proposals aimed at curbing the crisis early. At the center of these legislative efforts is a specific economic hypothesis. Over the past few decades, technological changes in food production and distribution have steadily lowered the relative price of energy-dense, unhealthful calories, incentivizing widespread overconsumption. If cheap junk food is the primary driver of obesity, the standard policy assumption is that we must artificially raise its price. This is the logic behind the fat tax, levying financial penalties on fast food to reduce demand and, theoretically, lower body mass index among children. But the efficacy of that specific policy lever is directly challenged by economists Lisa Powell and Frank Chalupka in National Bureau of Economic Research Working Paper 15046. By shifting the analytical framework from standard cross-sectional snapshots to longitudinal fixed effects panel data, Powell and Chalupka demonstrate that taxing fast food yields statistically insignificant results for child BMI. The data reveals that the true economic lever is actually the price elasticity of fruits and vegetables. The current legislative focus on penalizing fast food is targeting the wrong variable entirely. To understand why the fast food tax theory collapses, we have to look at how researchers built their models. They began with individual-level data drawn from the Child Development Supplement of the Panel Study of Income Dynamics. This demographic and biological data was geocoded by zip code and merged with specific regional food price indices collected by the American Chamber of Commerce Researchers Association. To ensure exact dollar-to-dollar comparisons across different regions and years, these food prices were meticulously deflated using the Bureau of Labor Statistics Consumer Price Index. Researchers then layered in Dun & Bradstreet market data to measure the exact density of fast food outlets, supermarkets, and convenience stores per 10,000 capita in those exact same zip codes. With the dataset assembled, Powell and Chalupka first ran a standard cross-sectional ordinary least squares regression. This OLS model represents a static snapshot, examining the data at a single point in time. Here is the baseline OLS equation. The dependent variable is the child's BMI percentile, with independent variables for individual characteristics. But the crucial metrics are the vectors isolating local food prices and the outlet context, which calculates the physical density of stores and restaurants. In Table 4's cross-sectional data, the OLS model shows a strong negative correlation between fast food prices and low-income children's BMI. Translated to price elasticity, it sits at negative 0.77. Thus, a 10% tax appears to drive a 7.7% reduction in BMI. If a policymaker stopped analyzing the data here, the empirical evidence would easily justify drafting a fast food tax bill to solve the obesity crisis. But the cross-sectional model contains a severe econometric flaw, omitted variable bias. The residual error term at the end of the OLS equation is actually absorbing hidden confounding factors that the snapshot data cannot properly isolate. The main culprit is the variable VI, representing time-invariant, unobserved individual heterogeneity. These are persistent realities specific to each child that cross-sectional data ignores. Their genetic baseline, their household's entrenched dietary preferences, or their neighborhood's socioeconomic characteristics. To solve this bias, the researchers deployed a longitudinal fixed effects panel model. The fixed effects model utilizes two distinct survey waves from 1997 and 2003, tracking the exact same children over a 6-year period. In the fixed effects equation, by analyzing changes within the same individual over time, the model mathematically differences out those unobserved, time-constant hidden traits. With the hidden biases stripped away, the model finally isolates the unconfounded biological effect that specific price changes have on that specific child's weight. By eliminating time-invariant, unobserved traits, the fixed effects model forces the data past mere correlation, allowing us to see actual causation. In Table 4's fixed effects results, the fast food tax argument falls apart. The fast food coefficient drops to negative 4.96, losing statistical significance. The true causal variable sits directly above it, the price of fruits and vegetables. Data proves that a $1 price increase for fruits and vegetables drives a massive, statistically significant increase in a low-income child's BMI percentile ranking. Table 5 illustrates exact price elasticities. The full population elasticity for produce is 0.25, but for low-income populations, it jumps to 0.60. This severe asymmetry shows low-income children are vastly more sensitive to the price of healthy calories. Beyond the direct monetary cost, the fixed effects model also measures the opportunity cost of time and spatial access. The data shows that adding just one single supermarket per 10,000 capita in a zip code yields a statistically significant reduction in low-income child BMI. Conversely, increasing the density of convenience stores in that same area reliably increases their BMI percentile ranking. Physical spatial access and the monetary cost of healthy produce are the proven economic determinants of low-income child weight. The cost of a fast food burger is statistically irrelevant. This summary matrix details the reality for policymakers. Rigorous panel data methods prove that attempting to manipulate child BMI by taxing fast food is an ineffective use of legislative power. To actually close the BMI gap across demographics, policy must aggressively lower the relative cost of acquiring healthy foods. The first data-backed solution requires direct fiscal subsidies for fruits and vegetables. Modifying federal assistance programs like the USDA's SNAP benefits to heavily subsidize fresh produce perfectly targets the vulnerable demographic where we measure that high 0.60 price elasticity. The second solution requires implementing local zoning incentives and targeted tax breaks to encourage supermarket development in underserved areas. This directly addresses the spatial opportunity cost, ensuring that physical access to healthy calories is completely removed as a barrier in food deserts. Cross-sectional data easily creates illusions of correlation, misleading public health strategies for years. It requires longitudinal, individual-level tracking to reveal the actual mechanisms of causation. Rigorous economic analysis proves we cannot simply tax our way out of the childhood obesity epidemic.